Welcome to this episode of Morning Report Emergency Medicine. I'm Alec Weir. This is the case of the gloves are off. A 53-year-old female with a past medical history of chronic kidney disease on hemodialysis, diabetes, and hypertension presents to the ED with leg pain and swelling. She was seen in an outside hospital following a motor pedestrian collision 4 days earlier with no injury identified. Her vitals are 36.7, heart rate of 80, blood pressure of 171/67, respiratory rate of 16, setting 98% on room air. And this is what her leg looks like. This is not good. Motor pedestrian collision, went to an outside facility, told she didn't have an injury, and she's been walking around like this for 4 days. There's diffuse edema in the soft tissue, but no real fracture. You can see that there's fragmentation of the calcaneus here at the Achilles insertion. This is likely chronic. This is not where she's having any of the pain. And here's her tib fib. Diffuse edema, worse in the anterior pretibial region, but no fractures. On physical exam, that right lower extremity, the skin has a large weeping blister to the right anterior shin, extending all the way from the knee to the ankle. Pitting edema 4+, but the compartments are soft. Her motor is limited by pain, but she's got no pain with passive motion of the great toe, no pain with passive movement of the ankle. It's painful, but what the picture they're painting is this is not compartment syndrome. She's got globally decreased sensation to pinprick, but not light touch. She's got a 2+ DP and PT pulse, and her cap refills less than 2 seconds in all 5 lower extremity digits. This is a Morel-Lavallee lesion, and pardon my French, the only French I seem to know are the 4-letter words I use occasionally in the emergency department. Baguette. Baguette. This is a closed degloving injury. And now, strictly speaking, it's only a true Morel-Lavallee lesion when it overlies the greater trochanter of the femur. But it gets used for all closed or internal degloving injuries. You have this subcutaneous tissue separation from the fascia. It's associated with considerable morbidity in trauma patients, and the treatment, operative, surgical debridement, and skin graft. This tissue dies. That's what this patient underwent. You can see here from her intraoperative photo, this is with that tissue removed, this is what it looks like. And she underwent skin grafting and actually is doing quite well. So what do you need to know? The Morel-Lavallee lesion, this is a closed degloving injury, and it's ± fracture. So if there's no fracture seen on your film, and you see these patients and they're in extreme amounts of pain, they maybe have more swelling than you'd expect, it's more bruised than you would expect, or it's getting worse between your initial evaluation and time of discharge, think about internal or closed degloving injuries. Now truly it's only a Morel-Lavallee lesion when it happens over the greater trochanter, and that's where it most commonly happens, but it can happen anywhere. And the treatment, operative. As always, you can follow me on Twitter at Weir_Alec, or subscribe to this channel for more updates from Morning Report Emergency Medicine. Keep your eyes out for those interesting cases.